back to Dementia Education Night 2024. As I mentioned, this is an annual event with the Alzheimer Society Huron Perth. I am Jeanette Sears. My coworker Christy Bannerman is also here. We are the public education coordinators from the Alzheimer Society of Huron Perth, and we are just so happy that we have so many people here with us this evening. And of course, we are extremely excited to welcome Dr. Sandra Black. Dr. Black is a renowned cognitive neurologist and a senior scientist at Sunnybrook Hospital in Toronto. She is the scientific director for Sunnybrook's Sandra Black Centre for Brain Resilience and Recovery. She is considered one of the foremost experts on vascular cognitive impairment, Alzheimer's disease, and dementia research. She's been a pioneer in her field, and she was the first woman in Canada to head up a division of neurology. I think that is amazing. Dr. Black has had a 40-year career as a clinician researcher, and during that time she's received numerous awards, including being appointed as an officer to the Order of Canada and the Order of Ontario. During that time she's authored more than 600 publications and contributed to many leading advances in the field of dementia and neurodegenerative disease, stroke-related disorders. So Dr. Black is here tonight to talk to us about a topic that is very important to us here at the Alzheimer Society, the heart-brain connection. So welcome, Dr. Black.
My pleasure, and I compliment you for choosing this very, very interesting
Not being able to see this, I don't know.
It's very dear to my heart, but I'm going to be talking more as a brain expert, not so much the heart expert, but I'm going to try to show you how interconnected they are. Can you hear me okay?
Yes, we can.
Okay, so I'll be looking away to make the slides go. So if I look away, it's not because I'm being distracted.
Yeah.
But this is my disclosures because I'm very active in clinical trials. I have been since the 1990s when we started to have options for both stroke and for Alzheimer's and other dementias. I do not take the investigator fee. I fall that back into the team, but I do some advising, and it's listed here. And I do benefit from salary support from my peers and from various foundations that help with the research itself. So my learning objectives are to emphasize how there are many types of small vessel diseases in the brain that can interfere with amyloid clearance and can contribute, especially to late onset Alzheimer's disease, that is, over the age of 50, 65. So what I'm going to do is I'm going to review some of the associations of cardiovascular disease, that means heart and vessel disease. The big ones being hypertension, heart attack. Of course, hypertension, heart attack, you're familiar with, but just hyperperfusion syndromes where your heart is failing, as congestive heart failure, is also a contributing factor. And something called atrial fibrillation, where you have an irregular heart rate, which can lead to some problems we're going to talk about later. And these are all very important for brain health and can also lead to cognitive impairment. That's what I'm going to be emphasizing tonight, because actually in preparing for this, I even learned some things myself. And I'll mention that the American Heart Association is now starting to want to pay more attention to heart cognition interactions. So the main bottom line is going to be, though, to say that not only vigorous management of vascular risk factors is neuroprotective, but there are a whole bunch of things that we can do, especially I'm going to emphasize exercise, as an investment in brain health at any age.
Dr. Black, could I just interrupt for one moment? There's some people who are saying your volume is a little bit soft. Is there a chance to speak louder or turn up your volume?
Okay. I don't know how to turn up my volume. Gosh. Is that better if I just...
Yes. That's better, significantly.
Okay. I'll try to sit forward as opposed to back.
Thank you so
I'm going
much.
to talk about, we always like to give fancy names. We call it the interconnectome. We like to give fancy names to these ideas, but basically it's that the heart and the brain are interacting all the time. And this two-way connection is important because the heart provides oxygen and glucose and nutrients to sustain the brain. And the brain in return, as I'll mention in a sec, provides regulation of aspects of the heart. You may not realize that the brain is also affecting how the heart is beating, and we'll talk about that in a moment. And then cardiovascular disease is associated with, can be associated with decrease in gray matter volumes. You know, in the brain, you've got gray and white matter. The gray matter is the cortex, and the white matter is what's connecting all the gray matter areas together. It's kind of it's like the highways, and the houses are kind of the gray matter. And these networks have been associated with heart disease. So for example, if you have thickness of the left ventricle, it can, like it's the heart is starting to be stiffer. You can have injury to the white matter tracts in the brain. Those are the highways and the side roads that are connecting the different parts of the brain. And so there is an effect on the connections and also on the gray matter itself. So now we really are becoming much more aware that risk factors, vascular risk factors, and cardiovascular disease can lead to brain injury and disrupt normal brain structure. We'll talk about stroke as the obvious one, but there are these more subtle things that can happen. And this is shown here, this kind of teeter-totter between the sympathetic and the parasympathetic system. Essentially, the sympathetic system is the adrenaline system. That's the arousal system, and it's the system that sort of wakes you up in the morning, it gets you going. So coffee sort of helps as well. The parasympathetic is the system that looks after all the organs. So you've got the brain affecting the heartbeat, the function of the liver, the stomach, the gut, the lungs, everything. And there's this back and forth all the time going on, and we have to kind of keep both sympathetic and parasympathetic systems happy if we can. So this is just to show you how complex it is and how bidirectional the teeter-totter is between the adrenaline system and the kind of vagal nerve, which is the more sort of resting state, digestive system, and calm your heart down kind of system. That also is involved when people are doing like yoga or even deep breathing. If you deep breathe through your nose slowly and out through your nose without using your mouth, you actually stimulate the vagal nerve system. You also help to secrete something called nitric oxide. It can have a relaxing effect, actually. So I sometimes do that when I'm feeling tense. So let's talk about hemodynamics. That means the blood flow and how fast and slow the blood flow is. And we'll talk about this on a few key fronts. There's the question of heart failure, fibrillation, and coronary artery disease. And what's really interesting is just this year, for the first time ever, the American Heart Association came out with a scientific statement. This is 2024, saying, hey, we better think about, brain health when we're talking about heart health. And so they started off by emphasizing the importance of heart failure, atrial fibrillation, and coronary artery disease. So I'm going to talk about those three. And they said later on, they're going to look at congenital heart disease, when people are born with heart problems and how that's important to compromise function, and also depression. So there you really have an interesting interaction between the brain and the heart in the context of depression. So they're going to have some scientific statements on that as well. So here is a picture of the brain's vascular network. And it was done by injection, postmortem injection of a colored fluid that filled all the vessels. And it's to point out that the brain is really a vascular organ that happens to have nerve cells and glial cells and other cells embedded in it. But there are actually, I'll talk in a minute, how many miles of vasculature there is. So we have various, what we call vascular cognitive disorders. Cardiovascular risk factors are important: hypertension, diabetes, their genetic makeup, high cholesterol, heart disease, they're all very important. because they can lead to damage to the vasculature. And then you can get strokes where you have a large vessel blockage. You can have strategic infarcts, depending if it's like the language area is affected, that you're in more trouble than maybe a non-language area. You can have multiple infarcts, which can contribute by themselves to dementia without Alzheimer's disease. You can have small vessel infarcts. These are lacunes or little holes. There's some hereditary conditions, something's called CADASIL, where people have a genetic predisposition to have these little strokes. I won't go into that detail, but they are sometimes they are hereditary. You can have hemorrhage, like if you hit your head hard and you get a subdural, that's blood that's between your brain and your skull. You can have subarachnoid hemorrhage, where you bleed into the spinal fluid or the spinal fluid around the brain. Or you can have an intracranial hemorrhage. And these are all types of stroke. And of particular interest, the types of stroke, especially hemorrhage, that's one of the things that can happen with the new disease-modifying therapies, not yet approved in Canada, but under consideration. And some of their side effects, as you can get leakage from the vessels, it's called vasogenic edema, and you can also have hemorrhage. And occasionally it can be lethal. So the new disease-modifying therapies hold some promise, not approved yet in Canada. There's some controversy about how effective they are, but they nevertheless can be associated with some serious side effects. And then finally, if you have a cardiac arrest, if your heart stops, your brain stops. You all know that. And also, if you don't rescue somebody, and that's why some of the rescue agents in YMCA's and so where you can resuscitate the heart, people learn to do that. It's so important because you can't tolerate not having blood flow for very many minutes. The other thing is you can have hypotension for various reasons that have to do with what we call autonomic control, where the blood pressure is not increasing when you stand up, for example, to hold your circulation to the brain. So there are various ways that you can have under insufficient blood flow. And the result is you get damage to various cortical and subcortical structures. Those are the brain structures. And you can get interruptions of the connections between the brain structures, the cortex. And I won't go into details of that. Many of you may be aware that there's a cognitive test battery called the Montreal Cognitive Assessment, which when it became available, maybe it's almost 20 years ago, is widely used now in stroke clinics, even in cardiac clinics, of course, in cognitive neurology clinics, even family doctors are using this because it's quite a comprehensive 15-minute test that can characterize various categories of cognitive function, for naming animals, remembering things, paying attention, like digits forwards and backwards, repeating sentences or understanding the meaning of words, understanding abstract thoughts like what's similar between a banana and an orange. Also, orientation to date, which is a form of memory task. So just wanted you to be aware that we use this all the time. Family doctors that you've encountered might also be using it. And it's sort of considered a bit better than a previous one, where it was called the mini mental states. So now let's talk about the veins and the arteries and the neurovascular unit. You're showing the veins, so the blood flow comes into the brain, to the arteries, and it becomes arterioles, and then ends up as capillaries. Eventually gets drained back to the heart, so that you have a circulation, and there are venules that then take the blood from the brain. And it's thought that 400 miles of blood vessels in the brain, as I mentioned, which seems extraordinary, but talk about efficient packing, it's kind of amazing. And then the other thing is we're talking not about just a nerve cell, a neuron, or a blood vessel, because in fact, how the brain works is really like a family. There's a family of cells, and they're all important, and they all are part of what makes your brain function. So you have, to the right here, you can see the cerebral arteriole, which is how you're getting the blood to the brain. And actually, if the brain is going to be, if you're starting to do an action, let's say with your hand, the blood flow will increase to the part of the brain that controls your hand. So you have to have this kind of increase and decrease that's appropriate to what you're doing. That's controlled by the smooth muscles, the smooth muscle cells around the arteriole that allows it to get smaller or bigger depending on how it contracts. And the endothelium, the layer inside the arteriole, is also very important for substances that are important for brain health. Then you have the other, as part of the family, you have the astrocytes shown on the right, which are the cells that try to keep substances from the blood out of the brain, tries to protect the brain. It's called the blood-brain barrier. And they also get up in arms when you start to get Alzheimer's disease or you have some kind of like infection or something, then they start to get more active. You also have other perivascular cells, something called microglial cells, which are part of the kind of immune inflammatory reaction when you have something going on like COVID or some other injury. And then you have the neuron. So you can see the neuron, which is really the basis of how we think and who we are, and is what we all emphasize, because of course it has to be healthy for you to be able to do anything. But see, it's a whole family of cells that you have to understand has to be looked at. So I mentioned about the 400 miles, the surface area for the exchange between the blood and the brain itself is 12 square meters. It just kind of knocks my socks off when I think about this. But this blood-brain barrier is really important for keeping substances out of the brain that aren't good for you. And this is just to depict, this is looking at a coronal view where you're slicing the brain from the front back. And on the right side, you can see the arteries, which are the supply to the brain of the blood coming in from the heart. And the veins are where they're draining the blood. And the problem is that everybody's been focused only on the arteries, but the veins are also important. And I'll show that they're important when it comes to something like called white matter disease. So you have to have a circulation in the brain, just like you do in the body. The arteries, you'll notice on the right side, there's a kind of empty area here where there's some underperfusion, and that's where you start to get some of this white matter disease because the veins aren't getting their fair share of the blood flow. So that's only the case in humans because we've got such a large frontal lobe that it was hard for the expansion of the frontal lobes for the arteries to keep in close enough contact to these deeper venules. So let's talk about these different small vessel disease pathologies. There are multiple phases of small vessel disease, and this is just kind of showing a quick picture. On the lower side, you can see a recent small stroke. It's like hyper intense on a certain type of MRI scan. It can eventually become just some white matter hyperintensities. That may just be some leakage around the vein. This is a lacune that actually has become a hole in the brain because it's what they call cavitated, and then so there's no function inside that area. These are the perivascular spaces shown here, which you can see kind of radiate out. This is the back part of the brain, and I'll show you some examples of some of the work we've done trying to discover all these different things. Then the microbleeds, this is where you can get iron deposits in the brain. If a red blood cell escapes from a vessel, it will end up black because the hemosiderin and the iron in the red blood cell turns into hemosiderin, which is iron. And because you're in a MRI scanner, it gets magnified. Even though it's only about 200 microns, it's tiny, tiny, tiny. You can see it. And finally, what we call microinfarcts, I'm going to show you that those can come and be associated with atrial fibrillation. So this is just showing you a small lacune in an 85-year-old gentleman who also had Alzheimer's disease. This is what the vessels look like when they become scarred from aging or high blood pressure that's not treated, or diabetes. You can start to get obliteration of it or narrowing of it. It's not as flexible. And you can also, it's harder to sort of regulate the blood flow when you start getting this this stiffening, and you get leakage around it. And as I'll show you, this is how you can sort of get into trouble, partly because if you have a stroke and you have vascular disease in the brain, it can in turn have effects on the sympathetic parasympathetic system and also on the many aspects of the body. You don't really think that the brain is controlling and what in the same way that you would think that the heart is. It's more subtle than the heart controlling the brain. If you have no blood flow, then you have no brain flow. But this is also very complicated, and it shows all the interactions, parasympathetic and sympathetic, that's going on. Even what's going on in your gut, the gut microbiome, for example. And I don't have much time to go into this. It's just, again, to show the complexities. So the prevalence of these lacunes, really, it's changed as we've gotten better with management of blood pressure, etc. These are little 3 millimeter diameter lesions. They're thought to be silent strokes. And initially, when they started being aware of this in the late 1990s and 2000s and did MRI scans for the first time, we could see them, about 28% of people over 65 had these little lacunes. And they were 10 times as common as having a full-on stroke that you could see, which was much larger. The frequency depends on age, but you could see them even in younger people, depending again on their vascular risk factors. And in those who had no baseline infarcts, they did show them later on when they followed them up over time. So they seem to be happening as people would be aging. There was also a study in Rotterdam in Netherlands, and they looked at 1,000 people, the ages 60 to 90, followed over 4 years, and they found if they had these little strokes, they were more likely to have a cognitive decline. They had twice the risk of becoming demented over the next several years, over 4 years. They had 5 times the risk of stroke and 3 times the risk, even if you corrected for some of those vascular risk factors. But now we have much better treatments for cholesterol, for diabetes, for blood pressure that are much safer and easier to use. So we're getting better at it. And this percent, it used to be over 65. Maybe 20% of people would have quite a lot of this white matter disease. Now it's more like 10%, and that's because of better management of our blood pressure, our diabetes, our cholesterol, and other vascular risk factors. So this is just showing that you have more of these infarcts when you have stiffer vessels, which would come from being diabetic or hypertensive. So it's so important to have your blood pressure under proper control. Now, around the brain, you can see these little dots here that actually aren't strokes. They're just spaces around the vessels themselves. They're called perivascular spaces. And that's the space in which the brain is pumping stuff out of the brain as you do your daily job of being awake and out and doing your daily life. You are making toxic substances, including amyloid, that have to be removed from the brain. And so that happens during deep sleep. And that's why having deep sleep, which is slow wave sleep, is really important. You need about 6 cycles per night in order to properly cleanse the brain each night along these perivascular pathways. And that becomes more difficult when you have hardening of the arteries, or of course, if you have sleep apnea. That's why sleep apnea is really important to treat and take seriously. And it was found actually that when people had disordered sleep, like sleep apnea, they had larger perivascular volumes shown here. And you can see them just sort of at the surface of the brain, just sort of projected from deep. The other thing is you can have, without any vascular risk factors, you can still have, with aging, remodeling of the arteries. So this is showing, it's called arteriolar tortuosity. And this was a beautiful study that was done almost, I guess, 2007, quite a few years ago. And they looked at different people at different age groups. So on the left, somebody in their 50s, 60s, 70s, 80s, 90s, or somebody with hypertension. And you can see once you get to really remodeled, even if you don't have any of the other vascular risk factors, just from aging, you end up not having perfusion. You end up with a hole. So just aging can end up with remodeling, leading to a hole in the brain called a lacune. The other thing that you have is that since you are trying to get amyloid out of the brain during deep sleep, normally that works well, but if you have a predisposition, you have too much amyloid, as you see in Alzheimer's disease, then you start to get into trouble because the amyloid can begin to accumulate along the vessels, and that can lead to injury to the vessels and to microbleeds and to bleeding. This is showing bleeding in the brain from what's called amyloid angiopathy. Now, if you have amyloid angiopathy, you can have these microhemorrhages and so on, but you can also end up with a big hemorrhagic stroke. And this is shown on this slide, where this was a gentleman who, a lawyer, and he started to seem a little funny, and he was like, they thought he was drunk because he wasn't speaking properly. So they sent him to the emergency department. It turned out he had a large hemorrhage in his left parietal lobe, which has to do with speech and being able to do things properly with your hands and so on. And so he had to be admitted. At the moment, we don't usually, we can take a blood clot out if it's bad enough, but we certainly can't give it TPA. So you have to know the difference between a hemorrhagic and an ischemic, that is a blockage type of stroke. But here's an example of someone who had hemorrhage. And over time, he did recover. This is what his brain looked like. Sorry, you can see all these little black spots. And the blood turns into black because it becomes hemosiderin. And then over time, what happened is he did eventually develop the symptoms of Alzheimer's disease. So in fact, the hemorrhage was the beginning of his Alzheimer's disease. And sometimes people with Alzheimer's disease can end up having a hemorrhage that can be fatal. And what these disease-modifying therapies that are speeding up the exit of amyloid along the vessels can do is they can lead to a hemorrhage. But it can also happen spontaneously, so that's important to know. And this is just showing what the amyloid angiopathy looks like. This is modeled in some animals, and also that you tend to get amyloid in the back part of the brain in people with amyloid angiopathy more so than in some of the other areas. Finally, I'm just going to talk about a little microinfarcts, which we can see now on the higher resolution MRI scans. And they're so hard to see that you have to look at these arrows. And you can see there's little streaks there, little streaks. And these are microinfarcts that can be associated with atrial fibrillation. And if you have enough of them, they can start to injure the brain to the extent that you can actually have cognitive impairments. That's why atrial fibrillation is very important to recognize and to be able to treat. And we'll talk about that more in a moment. So let's just talk about the venular pathology, and then we'll come to those other heart-brain connections. This is what the periventricular white matter disease looks like, and we're just showing different volumes of it. This would be a very mild amount. This is a little more, around 10 cubic centimeters. It can start to have some subtle effects on cognition. 25 centimeters, you're starting to fill up more of the space, and you can see at 50 cubic centimeters, there's a lot of white stuff in the brain. Now, what it is, it's actually leakage around veins that have hardened. They've become what we call collagenized. And so they're leaking, and they're actually, it's water in the brain that you're seeing there. So that's been called leukoariosis. We always like to give Latin names or Greek names. It means kind of white. It means white. I guess ariosis means sort of thinning, and it's white and it's thinning. And in the cardiovascular health study that I mentioned before, only 4% of people back in the 1990s had no white matter lesions. Almost everybody did. And those with extensive disease had poor cognition, gait and dexterity was off. It often makes you off balance. And they were slow. The processing was slow with this kind of threshold around 10 cubic centimeters. I won't go into some of the fancy testing you do that could show problems of what they call executive function. And this is just examples, but it looks like on an MRI compared to a CT. You can sort of see it on the CT where it's sort of dark. You see it so much better on a what do you call flare MRI. So the significance of the white matter hypertensities was that if you had moderate to severe white matter hypertensities, increased your risk of stroke of dementia, and of death. Also, your recovery after a blockage type of stroke was worse if you had white matter disease. And there was a faster decline overall in global cognitive functioning, especially decision making, switching, and processing speed. All of that was adversely affected by the white matter disease because it's causing difficulty in the front and the back part of the brain to interact with each other. Because as you may want to think of it, the back part of the brain is the perception part of the brain. The front part of the brain is your action. So it's perception to action. And sort of halfway through your head, you've got the posterior part of the brain that's going to guide action from the front part of the brain, but the front part of the brain is what initiates actions and takes actions, and it needs to be guided by the back. Now, this is just to show you why we understand what's going on here, why we think this is important to recognize, because it has to do with the deep veins in the brain that are draining from the surface of the brain in towards the ventricles and towards eventually the venous sinuses that take the blood back to the heart. But for some reason, everybody's preoccupied with arteries. If the arteries aren't working, then the veins are in trouble. But the veins can be in trouble on their own, and they seem to be ignored in the bigger picture because people they sort of wonder what this mysterious white matter disease is. It's just leakage around the veins. And this is showing a drawing of the veins of a middle-aged, 65-year-old man that one of our radiologists did, just to show you how rich that network is. And it gets stiffened and hard, and then you can't, it doesn't work so well. And at pathology, we showed when we followed people who did brain donation, we showed that it had to do with thickening of the veins. You can see here with a special stain, you can see it. Some of them were completely blocked, and it was the large veins that seemed to associate with this severity of white matter disease. Okay, now let's talk about some of the other vascular risk factors. And that has to do, again, with like blood pressure, very, very important. There were all sorts of studies where they started to say, hey, blood pressure is important. You've got to treat it. And in fact, we were allowing people to not have treatment until their blood pressure was over 140, until just about 10 years ago. And then they did a study and they realized that we're under treating blood pressure. And really, we should be aiming for a blood pressure of 120 over 70 or 80, not 140. And so we're starting to be much more aggressive about the blood pressure lowering. And we have much better medications now than we used to for calcium channel blockers and ACE inhibitors and angiotensin converting enzyme inhibitors. Anyway, there are lots of new blood pressure medications that are much better for the brain and they work much better. And that's allowing us now to actually give people a better middle and older life with their blood pressure under control, because they don't get Alzheimer's disease as easily, they don't get strokes as easily, and this has made a huge difference. In fact, the age-specific incidence of stroke, when they looked at this in Ontario, compared to the 1990s before we had all these medications and people through our system, thankfully had access, through the healthcare system, are struggling now with family doctors and all the rest of it retiring. But when you take care of the brain, through the blood vessels with diabetes under control and blood pressure under control and cholesterol managed, then you have people aging better. And the age-specific incidence of stroke has gone up significantly when you compare the 1990s to the first decade of the 2000s, because probably of management of blood pressure in particular, which is very common, and diabetes. Now, this is just showing a pattern where you can look at where in the brain do you see the thinning happening first in Alzheimer's disease. This is called the cortical signature of Alzheimer's disease. And it's not the whole brain that's affected. It's actually, here's on the left side, you can see this is like the parietal lobe, this is the anterior temporal lobe, so the frontal lobe. So there's specific areas, they're called signature areas of Alzheimer's disease pathology, where you see most of the injury. It relates to the tauopathy more than the amyloid. The amyloid sort of drives the tau. And so this idea of signature areas became important because it tells us that Alzheimer's disease is actually not a diffuse disease in a way. It affects certain areas of the brain more than others. Are you hearing me okay? Is everybody?
Yes, I can hear you. Okay.
Okay.
If you stay close to where you are,
Yeah, okay.
we have had one person mention it, but it seems to be working okay now.
Okay, sorry about that. I do talk fast sometimes, so I'm sorry.
Oh no, this is great. Thank you.
I just wanted to, sorry, I jumped some. Oh gosh, what did I do? Okay, let me just go back. Oh yeah, here it is. So they did the same thing, looking at different factors and looking at the parts of the brain that may show thinning. It's kind of interesting because they looked at different parts of the brain seem to be more affected when you had, for example, high blood pressure. So that's on the left side showing the red. If you have high cholesterol, it's a bit different. And glucose. Glucose is more the front part of the brain. So it's sort of interesting that they found that there were sort of signature areas of some of these factors that when they weren't under good control. Now let's talk about heart attack and brain changes, because coronary artery disease is important. About 30 to 60% of people with coronary artery disease will show evidence of cognitive decline, especially in memory compared to controls. And it's also associated with an increased annual rate of memory loss. All the more reason that coronary artery disease has to be recognized, has to be treated, even if, I mean, not just so you can't have a heart attack, but so your brain is getting, proper perfusion, because it has consequences if it's not treated properly. And this is just showing. It's showing that this is more of the case in women than men. As men get older, it's just showing the cumulative incidence of cognitive impairment in men versus women over time with coronary artery disease. Why do some develop, complications more than others? We don't know, but again, having white matter disease is a risk as well. And also there was an interesting observation, a smaller hippocampus, I'll show you what that looks like in a moment, seemed to be associated with a greater risk of having cognitive problems with coronary artery disease. Now, this is the hippocampus. This is showing you in a machine learning way what we can do so that we can now measure hippocampus with new methods. It used to take us 8 hours to measure the hippocampus slice by slice in the brain to get the ground truth. And this is where it is in the brain. You can see these two little structures where there's shrinkage, because really it should fill that space. So it's showing a bit of shrinkage. And now we can measure, we can give you volume metrics. That is, measure the actual number of cubic centimeters in your hippocampus. And that's where they're starting to say, there might be a smaller hippocampus associated with coronary artery disease. And in this one study, they looked at the benefits of exercise after a heart attack and people with coronary artery disease who had a heart attack, and they were doing the cardiac rehab at the Rumsey site, which is part of Toronto University Health Network, but it's actually close to Sunnybrook. So we were doing the exercise interventions there. And it showed that there really was a beneficial effect in people who had a heart attack. If their blood pressure is under control, if they stop smoking, that's not so much of an issue anymore. If they'd had, they had their cabbage or their stents or whatever put in. Also, the BMI, was a risk, but it showed that exercise was beneficial. And also they showed that the size of the left hippocampus, because the hippocampus on the left has more to do with verbal memory recall. It seemed to be that there was a better response for people who had larger hippocampi, which means that maybe there has been some gradual injury happening to the hippocampus with just the coronary artery disease. It meant people were sort of more able to benefit from the exercise program. Doesn't mean that it isn't still important to do it, but it just shows that you had even more beneficial effect if you had a larger volume. And also white matter hypertensives also were a problem. But if you exercise, you were benefiting more. So let's now talk about I know we're running out of time. I want to leave some time for conversation and questions. This is just, again, this idea of cardiac output, like how well you're perfusing your body and your brain is very important. And if you've got like congestive heart failure, you're not pumping enough blood to the different parts of your body, then it will take a toll. That's why there's a lot of interest now in congestive heart failure and trying to minimize that or treat that early so that you can actually make sure that the brain and the rest of the body is getting proper perfusion. That's the point that's being made by these slides. And just sort of shows that if your cardiac index, which is that you're not pumping properly, then you've got a pump that's not working well, then you have a greater chance of developing impairment in your cognition than if you have normal function. That's why cardiac failure is so important to treat and to recognize and prevent, if at all possible. Let's talk about the heart rhythms in the brain, and this is the atrial fibrillation story. And this is something that's been sort of recognized and known, and that is when you have atrial fibrillation, I showed you those little tiny microinfarcts that are occurring, and they are adding up to a kind of a multiple tiny attacks on the brain, so they're associated with some cognitive impairment. But they've also shown that there's some, if it's untreated, there is an effect on the total amount of gray matter and the white matter hyperintensity, the white matter volumes. So even if you're not having infarctions, actual strokes, there's still this subtle effect because when you've got AFib, you've got an irregular heartbeat, and you may not be perfusing your brain properly at the times when you're between a beat, and it also can be associated with pauses and other problems in the heart rate. Now there are ways you can go in and try to use electrical attacks on the source of the atrial fibrillation. Now they can put little plugs into the left atrial appendage, which is where the little clots form that allow you to end up having strokes in the brain, but also could be in your leg or anywhere in the body. So now there's a lot more we can do for atrial fibrillation than ever before. And I think that's a move forward, as well as we've got better anticoagulants that are less likely to cause problems with bleeding. Again, this is just showing these little microinfarcts, those little tiny microinfarcts. Showing a macroinfarct would be, here's in the thalamus, and here would be in the back part of the brain. And this little infarct here, by the way, is in the anterior left thalamic region. And because that connects to language, to abstract thought, and also to the memory area, you get an impairment in memory, in word finding, and in abstraction. So that's like 3 areas of cognitive dysfunction, which means you are, and you're not as able to manage your activities of daily living. So that's called dementia. So that's a strategic stroke that in one moment can create a combination of cognitive deficits that means you are less able to be independent. Pretty scary. It's a strategic infarct, that's what we call it. Anyway, this is just showing sort of in patients with atrial fib and atrial fibrillation and silent stroke, showing that the clinical outcome when they're not, when it's not managed is important. So it's just making the point that if you have atrial fibrillation, and now people can even, they have their heart rate monitors, and you've seen some of those ads about them. It's intermittent, and you may not know that you have it, but it is important to have those checkups and make sure from time to time if you have any, you feel a little faint, or you feel like, especially if you black out, then that's really something that has to be checked out. Then you often do a Holter for about 4 days or so, but now there are some faster ways to do like 14-day Holters. There are various techniques where you can just put like a thick Band-Aid type monitor on your sternum, on your breastbone, and then they can pick up more of these events, including pauses that can also be associated with atrial fibrillation, and then they can be managed, and they can be life-saving. Again, if you look at brain imaging, people who have atrial fibrillation unrecognized seem to have more chance of having some cognitive impairment, and maybe even the hippocampus was showing some reduction in the volume. So it's just to alert us all that atrial fibrillation is a treatable condition in most people. If you have a complete, kind of prohibition for having anticoagulation, then you're in trouble. But that's where they go in and maybe do the stent or the Watchman, where they put the little plug in the left atrial appendage, which is where most of the clocks go. So there's some ways we can get around that now. And this is just again showing that if you have atrial fibrillation, then you're going to have lower scores on your day-to-day function. Same sort of thing, just showing greater risk of having cognitive impairment. So I'm just going to end now finally to talk about fitness and brain health. And here again, the brain and the heart are hand in hand. And the common vascular risk factors for cognitive decline related to heart disease, stroke, and Alzheimer's disease are similar. One of the greatest risk factors is called age. But in the past, also alcohol in excess, that's changed a lot, I think, because alcohol has also now been implicated as, and the amount of alcohol that's recommended to be minimum or the maximum has changed dramatically, not so much because alcohol can affect the brain, but it can also be associated with cancer. And the World Health Organization a couple of years ago came out with some new guidelines. It used to be 10 drinks per week for men, 5 drinks per week for women. And now they are saying, because of the large population studies, they're very concerned that alcohol can be associated with cancer risk. It's often cancer, it can be cancer of the nasal, like your nose and throat, but also your GI tract, also lungs, but also in women, breast cancer. So now they're saying, the guideline is alcohol, maybe 2 drinks a week, better none at all. So that's actually been quite a dramatic new guideline coming out of the World Health Organization, which you could imagine is not very popular in the pubs of Ireland or the beer gardens in Berlin, but that's the truth. The other thing is some of the genetic risk factors, apolipoprotein E4, which in 23andMe you can even find it out. It's a risk factor for later onset Alzheimer's disease, where it'll be that you're starting to accumulate amyloid maybe in your 40s and 50s, so that you're positive and starting to have some effects when you're in your 60s and 70s. That's different than people who have an autosomal dominant form of Alzheimer's disease, where they're starting to accumulate amyloid in the brain from birth because they have a mutation, 50-50 chance from their parents, 50-50 chance of laying down amyloid from birth, and they get sick in their 20s, and they're usually dead in their 50s, by 50. And so that's kind of an autosomal dominant young onset type of Alzheimer's disease. The apolipoprotein E4 is associated more with later onset. It's about 25% of the population, at least in North America. We don't know in other nationalities so much, but about 5% will have the double E4, one from each parent, and the other 20% the other 20% would be just one of the E4s. And if you have an E4 allele, then you are more likely to develop Alzheimer's disease. And it's become very relevant in the context of the disease-modifying therapies, which we don't have access to in Canada at this point yet. They are available in the States, but you have a greater risk of having the vasogenic edema and of having hemorrhage if you're an E4 carrier. And that was even worse. It was worse in women than in men. Hypertension is the other one that's, I think you don't have to preach that anymore. And they're very good antihypertensive agents now. They're well tolerated. High cholesterol, same thing. Diabetes. Homocystinemia is something that can happen if you have a B12 deficiency, and it can be toxic to the blood vessels. And we do that routinely at the first time we see somebody because it's treatable with B12. Heart disease, you mentioned. Obesity, by the way, it's the visceral fat. It's the fat around your stomach, like between it's what surrounds the organs of your stomach that is most toxic. It actually, they make cytokines, they make inflammatory substances. You can have fat on your bum and your thighs. It's not as problematic, but it's around your viscera, your gut. And so that's a real problem sometimes with diabetes. It can contribute to diabetes as well, but it's bad for you in many ways. Previous stroke is a risk for, again, smoking, exercise. I mean, just don't drink if you can. Don't smoke at all. I think that's really changed. Be careful about your fat, sugar, and salt intake. Unsaturated fats, like extra virgin olive oil, 2 tablespoons a day, seem to have a beneficial effect. And sugar and salt you have to watch too. And have even some of the sugar substitutes are not so great for you. Physical activity we'll talk about in a moment, and sleep apnea must be treated. Really important to treat because you need 6 hours of restorative pumping out of the garbage, allowing yourself to have the dreams in between, and it's really important for brain health. Physical inactivity, I think, has been recognized for sure. And now I'm just going to talk a little bit more about that. Because there really is convincing evidence now that physical activity, just even light walking, has a robust association with better brain volumes and less cognitive decline in aging and in Alzheimer's disease. There's even some hope in Alzheimer's that you can mitigate decline. In fact, they've shown the people who exercise and have been active, and we'll talk about aerobics in just a moment. They show better size in the memory area, that's the hippocampus region, and in the prefrontal, in the front part of the brain. So it really does seem to, the brain and the body in that sense, is they're very interconnected. What's really interesting is when you aerobically exercise, that means you're usually using your thigh muscles and larger muscles. And I thought this was like really fascinating because recently they discovered that when you do aerobic exercise, if you're able to do so, you secrete a protein called irisin, irisin, which actually does a beeline to the hippocampus, to the brain area that forms new memories. And it helps to form new memories. And I think the reason for that probably is that when we all evolved in Africa, which is where we all came from, it was really important to, when you're having trouble finding food or you were trying to escape some, where there's vicious animals or whatever, you would send runners out to find places that might be safe to rest or safe to get away from danger, or also to find food. So they had to remember all the landmarks. So it was built in that when you're aerobically exercising and you're learning, you are actually helping your memories to be formed. I think that's pretty cool. So even modest amounts, however, are helpful. And I think even those at high risk of developing cognitive impairment show some reduction. So just can't emphasize enough the importance of even just light physical activity. Now here's something interesting. What do you think is the most important age of your life that physical activity benefits you later on? Don't read the whole slide. Just think what period in your life would it be? In your 30s, in your 40s, in your 50s? What do you think? So just guess. They have to say. They looked at almost like over 9,000 women who self-reported their exercise. It was based on them talking about it at different ages of their life and their late life physical activity. And after they adjusted for a whole bunch of things like age, education, marital status, diabetes, hypertension, depressive symptoms, blah, 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 they found that physically active women had lower prevalence of cognitive impairment in later life compared to those who were inactive. And the most consequential was actually in teenage, because it's like puberty and you're developing, and apparently doing that during teenage, maybe it meant to also continue to exercise through your life. But that was like the most impactful on their later life cognition, which I thought was pretty interesting. It helps at every age, but especially in teenage. So if you got those teens, make them exercise. Finally, this whole concept coming to an end now. The population attributable fraction, they call it, of potentially modifiable risk factors for dementia, which means the percentage reduction in cases of dementia if each risk factor was eliminated. Oh, sorry, this should say 45 percentile. I guess I mistyped that. So that's 45. It counts for about 45% of the risk. I'll have to fix that typo. And what's interesting, there's in early life, less education. Now that's something that's a societal responsibility. But not having sufficient education in life is very difficult to overcome throughout your life. And so it just underlines the importance of having a basic education for every child. You can acquire language automatically as a human being, but any of other things like reading and writing, for example, all of that has to be taught. And so much has to be taught and just isn't intuitively learned. And then in midlife, here's a new one that's come up that is starting to get some attention. It's not vascular, but it's hearing loss. Even subclinical hearing loss is a risk factor for later life dementia. It's probably because you're not stimulating the areas of the brain that are very affected by Alzheimer's disease. It's in the temporal parietal region. And so you're sort of understimulating it, and it may make it more susceptible to aging and Alzheimer's changes. The other is high, the cholesterol, depression is a risk. Traumatic brain injury wouldn't surprise you. Physical activity, we just talked about diabetes, smoking, hypertension, obesity, excessive alcohol. These are all small percentages, but they add up overall to 45%, including in later life, social isolation, air pollution, which we're now becoming much more aware of, and of course, visual loss. So this is the update that they've recently published through the World Health Organization in Lancet recently, saying these are the things that you should pay attention to and try to correct and try to optimize to have a healthier age experience as you age. So in conclusion, evidence demands more attention to the heart-brain connection, especially hypertension, coronary artery disease, and heart attack. Congestive heart failure needs to be treated. Atrial fibrillation, because of the association with brain health and cognitive impairment. Cerebral small vessel disease, including the venous disease, which everybody seems to think is innocent, but it's not, interferes with amyloid clearance, can contribute to late onset Alzheimer's disease. And it's commoner in people with heart disease if it's not well managed. Covert brain lesions and cognition need attention in cardiological observation and intervention studies. So even if you're a cardiologist, you need to be aware of this, and a lot more cardiologists are really starting to be interested in this. And likewise, as a brain doctor, I want to make sure that the heart is optimally managed. So management of vascular risk factors with attention to exercise is crucial for any age group. And so I'm just trying to point out that the heart, brain, and mind are bidirectionally interacting all the time. Lockstep, teeter-totter, having coffee together, or just holding hands. And with that, I just want to acknowledge many of my trainers and colleagues, my financial sources, Sunnybrook Health Science Center, or the CN Tower, you can see way down there because it was a bright day, and various organizations that I benefited from funding. And that's it. Questions?
Thank you so much, Dr. Black. This